Now we're going to assess the posterior and lateral chest of our patient. Of course, the patient still continuing sitting and with the arms outside and and of course we're going to stand behind the patient. So and after that we're going to untie the gown to expose the posterior chest. So ma'am, okay lang po ba sa inyo na i-expose ko po yung likod niyo po? So, now we're going to inspect as we expose the patient's posterior chest, and posterior chest, we're going to inspect the scapulae in the chest wall. So, the scapula should be symmetric and not protruding, and the shoulder and scapula should be at equal and horizontal positions. And the ratio of the anteposterior to transverse diameter is 1:2. So, now I'm going to assess the patient's posterior chest. It's asymmetric and horizontal, and of course the respiration is normal and not effortless. And for the anterior posterior chest the ratio is 1:2. So, as I inspect the patient's scapulae is symmetric and not protruding, and the shoulder and the scapula is equal and horizontal position. And the ratio of the anterior posterior to transverse diameter is 1:2, which is a normal findings. Next, we're now going to palpate the chest. So, in this assessment, we're going to palpate if there is a crepitus and if there is a tenderness of the chest of the patient. Of course, in this assessment, we should observe there's no lesions and masses. So, also we're going to while we palpate, we're going to observe if there's a vibrations in the chest, in the posterior chest of our patient. So, ma'am, I'm going to palpate your chest, your posterior chest po. Sabihin niyo lang po kung masakit po, ha? Ito po, ma'am, masakit po ba? In these procedures, we're going to do the same at the side of the posterior. And then, ito po, ma'am, masakit po ba? And then we're going to down. Ito po, masakit po. Ito po, ma'am. Ito po, dito po. Masakit po ba dito? Dito po. Dito po. Ito po, masakit po. So dito po. Dito po. Okay. So, as I palpate the posterior chest of our patient, there is no presence of the crepitus and it's non-tender. Next, we're going to palpate for the firmicutes using the ball of one hand. What the client says 99. This is to assess for the symmetry and intensity of the vibration. So, using the ball of one hand is more sensitive in the intensity of the vibration. So, in this assessment, we're going to assess the tactile firmicutes of our patient from the upper of the chest wall and going downward. So, ma'am, in this procedure po, we're going to assess your tactile firmicutes po ang vibration po ng inyong firmicutes po. In this procedure po, ilagay ko po yung kamay ko sa inyong likod at sabihin niyo lang po ng 99. Okay po ba yun? Sige po, ma'am. Ilagay ko po yung kamay ko, ma'am, and then say po kayo ng 99. Say po. 99. Sige po. 99. Ito po. 99. Ito po. 99. 99. So, for my patients, the firmicutes is symmetrical and stronger in the upper regions of the lungs, and and it decreases intensity as we moves down, which is the normal findings. And now we're going to note the use of accessory muscles when breathing. So in this assessment, we're going to evaluate the chest expansions at T9 or T10 of our patients. So first, we're going to place our hands on the posterior chest wall of our patient with our thumbs and at the level of T9 or T10. So we're going to observe the movement of the thumbs as our client takes a deep breath, and when the client takes a deep breath, we're going to examine the thumbs should be moved at the part symmetrically. So in this assessment, we're going to place our hands at the posterior chest wall of our patient, and we're going to use our thumb for us to locate and for us to locate the T9 or T10 level. So, ma'am, in this assessment po, we're going to assess your breath expansions po at your T9 or T10 level. So, I'm going to place po my hand. So, first I'm going to palpate it. So, sabihin niyo na po kung masakit po at hindi niyo po ma-tolerate yung sakit po. So, now I'm going to place my hand. So, first we're going to locate the bone prominence in the spinal of our patient and locate the T9 or T10 level. So, we're going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So, we're going to move here at the side and place our other hands, and then we're going to observe the breath expansions of our patient. So, ma'am, can you please take a deep breath po? Inhale po. So, as you can see, our thumb is moving outward and moving in. In this, as my observation, the patient breath expansion is my thumb moving out and moving in. So in this assessment, we're going to also measure a part of our thumbs by using the ruler and and then measure if it is a 5 or 10 centimeter part. So now going to measure. So of course we're going to utilize the pen marker and then measure the centimeter apart of the patient's breath expansion. So for my assessment, my patient's centimeter apart is 7. So the distance of the movement of our thumbs of our patient is 7 centimeters, which is symmetrically, and also the breath expansions of our patient is symmetrical and it is normal. So of course, because the normal centimeter part of our assessment is actually 5 to 10 centimeters. And then we're now going to percuss the posterior intercostal space of our patient. So the resonance is the percussion tone and elicited over normal lung tissue. So we're going to do the same. Do the same thing as how we palpate earlier, and then we're going to and the normal finding is what you should hear the resonance over the normal the normal lungs tissues. So we will start from the other hand and go to the opposite side, and then we're going to down and go to the opposite side again, and up until we're going to the lower portion of the chest wall. So we're going to percuss the 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 posterior chest of our patient. So ma'am, so in this procedure po, we're going to percuss your both of your lungs po just by just the light tapping of my hand po. Is it okay po ba, ma'am? Just tell me if masakit lang po, ma'am, ha? So I'm going to palpate na. I'm going to percuss na po. So we're going to percuss using our hand, utilizing the middle finger, and also as the other hand by the which is we're going to by using the tapping. So of course we're going to we're going to observe the intercostal space between which is between the bones po, in the bones. So I'm going to percuss na po, ma'am, ha? Just tell me po, masakit po ba? Ito po. So we're going to go. As we percuss, we're going to note if there's a tenderness or if there's a... Ito po, masakit po ba, ma'am? Dito po. So, we percuss the resonance is noted as the posterior chest of our client, which is a normal findings. So now we're going to get a marker and ruler to check the diaphragmatic exertion. So in this procedure, we're going to instruct the patient to take a deep breath and then fully exhale and then hold it, and we will try to percuss going down, and we're going to hear if there's a dull sound, and as we hear as a different sound, we're going to mark it and label it at the diaphragm. So we're going to instruct the patient. So ma'am, in this procedure po, kailangan ko po ang fully cooperation niyo po. First, you're going to take a deep breath po, and then after that, you're going to fully exhale, and after that, you're going to hold it, and as you're going to hold it, I'm going to percuss and I'm going to mark it. So, and again, after I mark it, you're going to take a deep breath, and after that, you're going to hold, then I'm going to try to percuss and mark it. Is it okay po ba, ma'am? Okay. Now we're going to place, first we're going to locate the scapulae, and then we're going to place, which is located here at the T6. And then after that, we're going to place our non-dominant hand using our middle finger. So here. So ma'am, can you please now take a deep breath and then fully exhale. And then after that, hold it lang po. So we're trying to percuss. So now as we hear the dull sound, we're now going to mark it. And after that, now ma'am, now you please take a deep breath po again, and then hold it po. And then I'm going to try to percuss again. Again, I'm going to mark it as I hear the sound. Okay. So ma'am, can you please now normal breath level. And these two marks, we're going to measure it using our ruler. So ma'am, normal breath lang po. And I'm going to measure it now. So as I measure, it is a 3.5 centimeter. So which is a normal findings. So next, we're going to auscultate the posterior chest of our patient, utilizing by the stethoscope. So first, we're going to warm it, and of course, we're going to hear the normal breath sound, which is a bronchial, bronchovesicular and vesicular. So we're going to note which is that sounds might be. So ma'am, I'm going to auscultate for your posterior chest po. Okay lang po ba yan? So now we're going to place the diaphragm. Using the stethoscope, we can hear the normal breath sound, which is we can hear the bronchial or bronchovesicular or vesicular sound. Sakit po ba dito? Ito po. Ito po. Ito po. So, as I auscultate, I hear the bronchial and bronchovesicular and vesicular over the posterior lung field of our patient, which is it is a symmetrical and bilateral. So, in that case, it is a normal findings. Now we're going to assess the anterior chest of our patient. So, we're going to make it sure that our patient is facing us, so that we can be able to inspect the anterior chest. So, in this procedure, we're going to expose the anterior chest of our patient, and in that case, we're going to remove the gown, so that we're going to be able to inspect it accurately. So, ma'am, in this procedure po, we're going to inspect your anterior chest. If it's okay with you na we're going to remove your gown po, and that portion only. So, normally, the patient say yes. Now, we're going to remove. So, now we're going to inspect the anterior chest of our patient, which is what we did earlier at the posterior chest. So, the anterior posterior diameter is less than the transverse diameter as noted as 1:2. So, the anterior posterior diameter is less than 1:2. So, it is 1:2. So, as we inspect, the ratio of anterior posterior to transverse diameter of our patient is 1:2. So, after that, we're actually going to note the quality and pattern of the respiration and observe the intercostal space of our patient. So, our respirations are relaxed, of course, and normally the respiration is effortless and quiet. It should be regular rhythm and normal depth at a rate of 10 to 20 per minute in adults. So as we inspect, the respiration of the patient is relaxed and effortless, and of course it's quiet, which is a normal findings. So now we're going to palpate the anterior chest as we did earlier at the posterior chest. So in this procedure, we're going to find that there is no palpable crepitus and lesions or masses. So then after that, we're going to palpate the anterior chest. We're going to palpate also for the crepitus using the ball web of one of our hand. While the client says 90 This is to assess for the symmetry and intensity of the vibration. So now we're going to palpate the anterior chest of our patient as we did earlier at the posterior. So ma'am, we're going to palpate your anterior chest po. We're going to just say yeah, yes or no if it is masakit po or hindi. So now we're going to palpate po ma'am. In this, ano po, masakit po ba? Dito po. So of course, we're going to also palpate on the other side for us to find if there's a lesions or masses. Dito po masakit po. Dito po. Dito po. Dito po. Dito po. So dito po. So, as I palpate the anterior chest, there is no presence of the crepitus and it is non-tender. So now we're going to palpate the fremitus using the ball of our one hand while the patient say 99. So ma'am, as we did also earlier, you're going to say 99 po as I palpate your chest po. So I'm going to place my ball head po ma'am. Just say 99 po.
99.
Ito po.
99.
Masakit po ba?
99.
Okay. So for the fremitus is symmetric and it's stronger in the upper regions of the lungs and it decreases in intensity as we move down. So which is that is a normal findings. Now we're going to percuss the anterior chest using again our non-dominant hand by placing it in the intercostal space rather. And for the dominant hand, we're going to percuss it by use our technique. So of course the resonance should be heard as we percuss. So ma'am, we're going to percuss your anterior chest po. So ma'am, sabihin niyo lang po if masakit po o hindi ha sa percuss po. So percuss na po. Masakit po. Dito po. Dito po. Dito po. Dito po. Dito po. So the resonance is heard as I percuss the chest of the patient. It is also asymmetrical and bilateral, which is the normal findings. So now we're going to auscultate the anterior chest utilizing the stethoscope. As we did earlier, we're going to the same manner. We're going to identify the different normal breath sound, which is the bronchial and bronchovesicular and vesicular breath sound. So ma'am, we're going to auscultate po your posterior chest po. Just as I said, inhale, exhale. So inhale po. Exhale. So, as I auscultate, there is no adventitious breath sounds present. And now we're going to proceed to the assessing the breath of the patient. So, first we're going to inspect the breast tissue. We're going to note the size, the shape, the symmetry in the lesions, the lesions and discharge and venous patterns, and of course the dimpling or the retraction sound. So ma'am, sa ngayon po, I'm going to assess your breast po and as well as your kilikili. So you do this po ma'am in front of the mirror every month, and then you need to first palpate your different lymph nodes po na malapit po sa breast nyo. So, unahin po natin po yung supravesicular, which is above the clavicle po. Itong buto po na ito, sa taas po nito. Try to palpate po. And then, sa ilalim po niyan, mayroon pong intraclavicular node. So, ipalpate nyo din po yan. And then, i-release nyo po ang kamay ninyo. And then, ipalpate nyo po itong central node po. Ipalpate nyo po ito. And then, ito po. Dito po manda sa kilikili po. And then, ipapalpate nyo din po ito, itong lateral node, dito po, sa inner aspect po ng inyong kilikili. And then posterior or cuspular node, dito po sa bandang likuran ng inyong kilikili. And then, anterior or particular nodes, dito po sa harapan. And then po, pagkatapos po, pwede nyo pong i-repeat po yung sa kabilang side din po. Ngayon naman po, ang pagpapalpate po ng inyong suso ay importante din po. So, i-demonstrate ko po ito sa inyo. So, in front of the mirror po, try to raise your hand po ninyo. And then, using your finger pads po, you're going to move in a circular fashion across across in your breast po, using your vertical strip method. So, ganito po. Start dito tayo sa pinakataas. And then, just move down po. Slowly po. And slowly lang po. And try to po kapain kung may nakakapa po kayong bukol, if meron pong masakit na part. So, ayan, balik lang po. Vertical po, ganyan po. Gandahan lang po. Huwag nakalimutan po na ipalpate nyo po dito sa pinakamataas po. Dito po. So next po is we're going to palpate a pied method po. Magpapalpate po kayo sa nipple nyo po, palabas po. Ganito po diba, across po diba yan. So dito po sa center ng nipple nyo, magpapalpate po kayo palabas po. Ganun po. So, ganun po. Then, balik na po kayo. Then, ipalpate ko lang po, palabas. Ganun po. And then po, lastly po, concentric circle po. So, tandaan po na sa pagpa-perform po nito, nandiyan po kayo in front of the mirror, sa harapan po kayo ng mirror, at nakahubad po. Itong top area lang po, para mas ma-appreciate nyo po ang pag-demonstrate nyo po. So for concentric circle po, mag-start po tayo sa nipple area, and then we're going to palpate po, then palabas. Parang spiral method lang po siya, ma'am. Ganito po. Circle lang po. So, dandahan lang po. Then, at kapain nyo po yung different areas po. Ganyan po. Okay. And, ang normal finding po, ma'am, it should be, ang inyo pong suso ay soft at hindi po siya masakit all throughout the procedures po. And then, ang gagawin niyo po yan sa kabilang suso din po. That is how you demonstrate po yung kung paano po mag-exam ng breast examination po for the axilla. So now we're going to inspect and palpate for apical impulse. So it is located at the fifth intercostal space, mid-clavicular line, and also we have to expose the area of the chest of the patient. We're going to palpate and then we're going to inspect it. So So in this procedure, we're going to expose the chest area of our patient. So ma'am, in this time po, we're going to assess your heart po ma'am. But in this procedure po, kailangan po na ninyo pong, kailangan po nyo na i-expose po yung upper part po ng chest. Okay lang po ba yun? Naka-provide naman po ako ng privacy po ma'am, para maging comfortable po kayo. So, ma'am, I'm going to expose lang po yung upper chest niyo po ha. So, we're going to expose the chest of our patient at the upper extremities. So, now we're going to palpate it. Ma'am, mag-palpate lang po ako ma'am ha. So, from here, with the clavicular line, I'm going to count 1, 2, 3, 4, 5. So, here. And then, we're going to inspect it for the and for the amplitude is usually small, like a gentle tap. The duration is brief, lasting through the first 2/3 of systole rather, and often less. So in obese clients or the clients with a large breast, the apical pulse may not be palpable. So in my case, the apical pulse impulse of my patient is normal, which is a normal findings. So next, we're going to palpate the apex left sternal border of our patient and the base of the heart. So for the apex or the left ventricle area or mitral area, in the fifth intercostal space in mid clavicular line, the amplitude, small duration, and not sustained systolic apical, and pulsation may not always be palpable. So this is the sternum. We're now going to locate the left sternal border. So we're going to count 1, 2, 3, 4, and then left sternal border. So here I'm now going to locate if there's a pulsation. So as my patient, I already located because she's a teen. So I can feel the pulsations. However, for the left sternal border for the fourth to fifth intercostal space at the sternal border may not be palpable, although small or non-sustained systolic impulse. Systolic impulse may be palpated, or especially in a thin patients. So now we're going to palpate and locate the base left or also known a pulmonic area at the second intercostal space, left sternal border rather, in our patient. So ma'am, palpate lang po ako ma'am ha. I'm going to locate here. I'm going to count 1, 2. So in the left sternal border. So here, in this area, this is where the pulmonic area is located, or where is our heart actually is located. So now we're going to proceed to the right, to the base right, or also known as the aortic area at the second intercostal space, right sternal border. So again, we're going to locate, magpapit ulit ako ma'am ha. 1, 2, here at the right intercostal space, or or the second intercostal space at the right sternal border. So so the base right or aortic area, or the second intercostal space, or the right sternal border may be it's may positive slight pulsation, and may be normal, and no diffusion. And also for the palpations, For the palpations not palpable at the base left, at the pulmonic area, and base right, the aortic area is except in the thin patients. So now we're going to auscultate the over the aortic area, pulmonic area, and the air point, and also the tricuspid area and the apex. So rate should be 60 to 100 BPM with a regular rhythm, and note for any abnormalities that we heard as we auscultate. So now we're going to palpate first and auscultate the aortic area. So now we're going to auscultate the aortic area using the stethoscope. So we're going to first warm the stethoscope, and then now we're going to locate the aortic area, which is from the second intercostal space at the right sternal border, which is it is based from the heart. So we're going to count 1, 2, second intercostal space at the right sternal border. So here, now we're going to auscultate it. Auscultate na kamang ha. And after that, after auscultate the aortic area, we're now going to auscultate the pulmonic area, which is from the second or third intercostal space. So again, we're going to palpate first. So 1, 2, 3, or the second, third intercostal space at the left sternal border. So here, now I'm going to auscultate. So as we auscultate the pulmonic area, we're now going to auscultate the Erb's point, which is located from the third to fourth intercostal space. So at the left sternal border. So again, we're going to palpate 1, 2, 3 at the left sternal border. So here, we're going to auscultate rather. So as we auscultate the Erb's point, we're now going to auscultate the mitral or apical area, which is located in fifth intercostal space mid-clavicular line. So again, we're going to palpate in the 1, 2, 3, 4 mid-clavicular line. So at the apex of the area. So here. So here. Okay. So ma'am, okay na po. And now we're going to auscultate the apex of the heart as the client lays on the left side. So ma'am, kailangan po nakahiga po kayo, and you're going to lay in the left side po. So assist ko lang po kayo in the left side po. Urong na po dito kayo. Sige pa po. So, and now we're going to auscultate the apex of the heart or the apical pulse when the clients lay on the left side. So the same area here. So, mag-auscultate lang po ako muna ha. Okay po. So, okay na po, ma'am. Pwede na po kayo. So, normally the S1 and S2 of the heart sounds or the lub-dub are normally present, and it should have a regular rate and rhythm. So, which is that is a normal findings. So, and now after After auscultate the patient's apex heart, we're now going to um, back her again in the supine position.